You're welcome to Empowering Forum. I am Imelda Essien. Our focus today is on maternal health. According to World Health Organization, 810 women die every day from preventable causes of pregnancy and childbirth. About 295,000 women died during pregnancy and childbirth in 2017. About 140 million childbirths take place every year, and proportion attended by skilled health personnel increased by 58% in 1990 to 81% in 2019. The number of deaths from complications during pregnancy, childbirth, and postnatal have declined by 38% in the last 2 decades, which is an average reduction of 3% per year. The pace of the progress is very slow. What is a possible way out? On the show today, we have Dr. Ameena Ali. She is a naturopathic doctor specializing in obstetrics and gynecology. She has been in organic medicine, home birthing, and maternal education of women in the last 29 years. She is a proud decorator of Gulf War veteran and 2020-2021 president-elect of the Rotary Club District 1790 in New York. She is the founder and lead advocate at Federation of International Gender and Human Rights. It's good to have you on the Empowering Forum. You're welcome, ma'am.
Good to hear you. Good to have you. Good to be here. And thank you so very much for welcoming me.
Okay. A lot of people would like to learn from you. They would like to hear from you because you have 29 years of experience. Oh, God. I'm impressed. Yes. It's amazing. So many people are looking forward to hear from you. So I'm going to start by asking. So you've been in organic medicine, home birthing, maternal education of women in the last 29 years. How do you intend to help women with your experience and expertise?
Well, I am not here to be of help. I'm here to be of support. One of the things that I like to say in that is that women don't need help to birth a baby. That's what their body was designed to do. Yes. That's what we were created to do. And that's what sets us apart from any other gender, is the fact that we can birth children. So we don't really need to help women do that. They do it organically. That's why I'm in organic medicine. But what we need to do is understand the body so that we can better support it. What does that mean? Support does not necessarily mean I'm going to hold your hand and walk you through it. No, support means I'm going to help you to understand the way the body works, then help you to understand how to keep it healthy so it can work optimally. And then I'm going to help you to understand what it is that you need to do after your process is over so that you can stay healthy, so that you can be healthy for baby, for more babies, and for the family. So what we do in organic medicine, which is different than allopathic medicine, which is the practice of pharmacology and giving you a pill for everything and making you sick with everything rather than keeping you healthy. And what sets us apart from how we care for our women is that we empower them. Before you even get pregnant, when you're at that childbearing age, that puberty age, we start educating you. We help you to understand what your body does, what it doesn't do, what it's supposed to do, and if you do it right, what it will be inclined to keep doing. Your body is not designed to break down. It's not designed to do anything that is destructive or unreparative to it. What it is designed to do is regenerate. Just like when you cut yourself, your skin regenerates. When you bleed, you have a scab. That's the regeneration process. That's all your body knows to do. So if you keep it healthy, it will keep regenerating. So the support is given to women to regenerate the goodness that's already there. We're going to get them away from the sick mindset. We're going to get them away from them complaining and all of the things that go into their mind that feed their body outside of the food. We're going to talk about diet and nutrition. We're going to talk about exercise, and we're going to talk about a way of life that is healthy for her. This is before she gets pregnant. Then, of course, once she gets pregnant, we explain the process, explain what it is that she's going through, and then help her to understand why her body needs to do this. Because sometimes we complain about the aches and pains, but sometimes your body needs to do this in order to grow. And then once baby's here, we help her to stay healthy with diet and exercise and nutrition again, keeping milk supplies up so we don't have to use anything supplemental, and then allowing her to understand that her body is designed to do it over and over again and regenerate this process over and over again, as long as she stays healthy. So this is how we do it in organic medicine. And this is how we offer it in education beforehand. So this is one of our processes. And then, of course, with pregnancy, it is always the care and comfort of mommy and family to help her to be a greater vice in this.
This support system, does it reduce the number of deaths in pregnancy and during pregnancy and childbirth?
It has decreased the number, but it has increased the desire and the need for more education. So now it's decreasing the numbers, but now it's a supply and demand as to get education. So I do quite a few Zooms a day. Maybe the average is about 15 Zooms a day on education.
Wow, that's great.
Yeah, it is. And they're normally in 30-minute blocks. So between my regular meetings, sometimes I have meetings from 8 a.m. to like 7 p.m., like every hour, every half hour. Most of the time I try to get them in groups so I don't have to keep repeating myself. I can get it all in one group. And then most of the time it is one-on-one. And this is when a woman calls me with her specific need. And then I'm able to talk to her one-on-one with the understanding of what it is that she is directed. Now, what did this do with this information, this age of information? It introduced telehealth and telemedicine.
Okay.
And that is a big thing. And I don't know if you're going to go into that as far as a question, but that is what it has brought, because we have to see each other face to face here. And just like we're doing right now, you ask me a question, I give you an answer, and help you to get to a solution. But I don't have to see her face to face. So now I can help more women, because just like you're in another country, I'm in another country. As long as the time zones are compatible, I can help and educate.
Okay, that's good. So your NGO, Federation of International Gender and Human Rights, has been in existence for quite a while. And then what is the driving force of the NGO?
Again, not to give anything or do anything, but to educate and support. The desire, just what it says, international, which is broad, diaspora, gender, which is specifically for women, but of course men are included, and human rights, because we need to bring back the dignity of what it is that we're doing as a people. So many times we're often given the opportunity to be better people, but we don't know how. We have been doing certain things so many ways and so many opportunities that we just don't know anything new. And then when we advent something that is new, different, and unique, it's automatically shunned, because most people don't like to change anything. They like the way they are until it doesn't benefit them. And now they're like, okay, what are we going to do? So when change comes, it has to be gradual, and it has to be effective as it relates to the person. So for example, if you tell me I'm tired of my hand hurting, and I say, well, why is your hand hurting? Well, I hit it on the desk every morning that I go into work. So I tell you, okay, so Imelda, stop hitting your hand on the desk when you go into work. And you say, well, I've been doing it for 20 years. Okay. This is just part of my routine. You see what I mean? So we have to get people to understand why they're going through what they're going through, and helping them to change their patterns so that they can stay healthy and safe. And that's hard, because people are creatures of habit. And this allows them to stay stuck in this pattern of illness without even realizing that they're ill. A lot of it has to do with traditional thinking. My grandmother did it, my mother did it, so I'm going to do it. And then the other half of it has to do with, I don't know anything else, so I'm just going to keep doing it. So this is where a lot of what it is that we're doing is to recreate the thought process and get us into more emotional intelligence to understand that there's a better way to do this.
That's great. That's great. That's perfect. So how do you intend to carry out disaster planning, preparedness, and readiness for expectant mothers and newly birth?
Okay, we just graduated on Friday. The first cohort.
They have a course of study for some months or a certain week?
Yeah, no. This was 12 weeks. It was over 3 months. Yes, it was during the COVID. I realized that it's time now, and it just so happened the COVID hit and most people are out of work. So this was a great time to have them to get into the fellowship. And we graduated 40 men and women that are going to go out and teach about maternal health and wellness, especially during crisis. And right now we're in a crisis. So just because we're dealing with COVID, or before it was malaria, some was typhoid, we're still having babies. So how do we care for women when society is in a crisis and they still have to have this baby? What parameters are set up for them? What hospital settings do they have? You know, so many women decided to do a home birth because they didn't want to go into a hospital where COVID was. That makes sense. But a lot of the governments were like, well, we don't have anything else, so you have to come to the hospital. So now the woman ran the risk of having her child contract COVID just by being in the room down the hall from someone that's coughing and sneezing and has COVID. And that, I thought that was like so harsh. So I said, no, we're going to do something different. So I put out a little post on LinkedIn. And I said, look, if you're willing to and wanting to do this, we're going to develop policy so that every country has a copy of a plan that they can put in place to help women. And it was overwhelming. I got maybe 400 emails saying, I want to be a part of this.
Are you serious?
Yes.
From different countries?
From different countries. And I only wanted to take 20 people. I ended up taking 40 just because it was so many. I had to. And they were coming from Zimbabwe and Egypt and Pakistan. I had a couple from UK and South Africa, and then we had people from Mexico and Canada. And I'm like, wow, this is crazy. And this is because these countries, especially in the continent, which is where I focus on, the African continent, so many laws, so many regions, so many countries don't have effective care plans for people that are pregnant. They just assume if you're pregnant, whatever's happening, oh, well, you just have to do what everybody else does. No, there's a difference in it. Women that are pregnant are it's like another gender. It's like male, female, pregnant, you know, and it's because there's so many unique and different needs. And this is why we have to have plans in place. So we literally just graduated the 40 fellows. It was a 12-week diplomatic fellowship. And now they are able to go out to teach this to their country. They have a protocol in front of them that they can give to each of their country heads and their heads of state. And they can also have this as implementation in their houses of assembly and houses of state, so that they can begin to implement this program into society and maybe get some funding for it. I'm trying to go into at least 4 to 5 countries to start building the clinics so that the rural areas will have the clinics in that area and be able to bring them forward in the care for women. So this is what we do. This is our mission. And I'm just so happy to be able to do it.
That's great work you're doing. So what is the requirement for you to enroll in this 12 weeks training, or have you closed for the year, or are you going to reopen to expand and allow other people to come in and participate to support women?
Of course, I have the second part of the maternal care fellowship that's happening in October. You have my information and my email, so you're more than welcome to give it out. But all they have to do is email me an updated resume. And because I'm dealing with the United Nations, it has to be an updated resume with your given, middle, and surname in that order when you apply, okay? And then they email me, they give me their WhatsApp number, the country they're from, and their name. No tribal names. It has to be the name that's on your passport. Or your state ID, and you send that to me. I review it, and once I review it and I see that you qualify, or at least the interest is there, I will set you up for an interview, and it's a 15-minute face-to-face, just what we're doing. I ask you a few questions to see if you're a fit, and then if you are a fit, you're welcomed in. This year, the second cohort, I have to take 70 this time because there's too much of the interest and not enough slots. So I have to take 70. I'm going to be doing it with one other person, so it's going to be 2 of us doing it. And we're going to be doing it in stages. So I'm going to do a couple of weeks, they're going to do a couple of weeks, and I'm going to do a couple of weeks. And this is so it doesn't get overwhelming. And then it's also because we want to make sure that everyone is getting what they need and they get their support as well. And the second piece is going to start in October. And
Okay.
also in October, we have a gender-based violence cohort. So there's 2 that's going to be beginning in October.
Is there any educational requirement for this, or anybody can be part of it?
As long as you are over the age of 18, you are either in
Eligible.
school.
Oh, you
Yes,
okay?
yes.
Okay.
Because you're going to be teaching it. So we don't want children in there and they have to wait for their parents to come. We don't want that. And we want them to be educated. I would prefer you to be in college, but I have to allow you to at least be in high school. So I say 18. And as long as you are in a human rights or a civic rights, an NGO, or something that is dealing with the topic. We really don't want someone that's just, oh, I don't know, I just want to do it just because there's nothing else to do. No, we want people that are genuinely concerned and maybe already in the field. Now, there is a young lady that's in the cohort right now who's retired, and she wants to make this a second career, which is amazing, because to know that she's on pension now means that she's free to do this. This is amazing. So she is able to do that. So we can do it, this can be a second career. But we want people that are genuinely interested, that is going to use this as a tool to go out and teach. And that's the bigger piece. We need people that are motivated to go out and teach, because that's where they can generate the money. And I know a lot of them are saying, I want to teach, but I got to eat too. So this is where you're trained, you're certified, and once you're certified, you're able to actually go out and teach this now on a greater level, so you can get paid.
Okay, what approach are you using to reach the women in the rural areas who are affected, or who may be affected by disaster, and or maybe hard to reach areas, and women when traditional methods are not really available for them?
That's right. And that's the hardest part. Our federation is working with the elders of the community. And a lot of the elders are being reached by the youth. So I love that. It's almost like if you know your grandmother is the elder of a certain community, you, Imelda, would reach out to me and say, Dr. Ameena, my grandmother is the elder of such and such and such. So I will now go through you and I will say, okay, ask your elder, your grandmother, if I may speak to her. So you put her on the phone. I speak to her and I say, look, this is the service I want to offer the community. And your grandmother, of course, being the elder, she will go to the community and say, okay, Dr. Ameena is going to be offering such and such and such. And they're going to be like, okay, come on. So it's a welcoming that is of the people, so that I can bring services for the people. But I'm doing it with the respect of including the elders, because they are the ones that are really over the community. I mean, we talk about law and government, and we talk about all of the big things, but really when it comes down to it, the elders are the ones that are over the communities, especially the rural communities. So we have the kings and queens, as well as the elders that are over the land and over the people. And those are the people that I reach, because those are the people that need the most help.
Okay, so aside the webinars and other events, what other ways do you intend to reach those people in the rural areas? Are you going to coach somebody to be there to able to translate it in the language that they will understand?
Right.
Okay.
Yeah, that's why we're training the fellows in each of the countries. So in other words, Imelda, you may speak English very well, but then you have your tribal language. Yes. So if I'm coming to your grandmother, if your grandmother doesn't speak English, then you'll be the translator. But in this, because you brought me to her, I will train you so that you can be the translator, so that you can bring it to your land. So another way is through linguistics. So understanding that the language is very, very important, and is something that needs to be preserved. So I don't want to come in there with the English language and force you to learn the language. I want you to come to get the information and have the translator bring it to you. So you preserve the language, you preserve the people and your traditions, and then you get them the same information that I would give you anyway. So this is where we're reaching women that way. The second way, or the third way, because the first one is literally giving them the education. The third way is physically going there. Because of COVID, we were not able to, we missed the boat from March to now to be able to go into the continent. Our goal in February was to be in the continent from March until September, training in different countries. We were going to do 10 days in each country, in the countries we chose, and we were going to do this training. And we said we were going to do the training for the 10, we were going to set up the training for the 10 days. And then we were going to do a global training on the net. So we were going to do it so that we had representatives from each of the countries we were going to go into. Well, of course, the virus hit us and the rest is history. But it's still not too late to get the training. And that's where Zoom was a greater vessel. So I decided to put the fellowship together so at least the word can go out now until we physically can get there. So it was kind of killing two birds with one stone. And a lot of people, a lot of the youth, I had maybe 80% youth on this training. So this is good because they're able to take that information to the elders and then they're able to take it to their community so nobody loses in the meantime. Yeah. So this is our way of connecting. So technology is the third piece.
Yeah, the technology actually helps and really helped you throughout the COVID-19 situation. Yes. Okay, so I would like us to take a brief break and then we'll come back to continue. If you're just joining us, you're watching Emporium Forum and we have Dr. Ameena Ali. She is a naturopathic doctor specializing in obstetrics and gynecology. She has been in organic medicine, home birthing, maternal education of women in the last 29 years. We'll be right back. Stay with us. Don't go away. So if you're just joining us, this is Emporium Forum. And we're going to go ahead and ask you questions on Gestation and Reproductive Resource Alliance Center for Education and Empowerment, Maternal Care Council. It has been categorized into a group and you've been doing this for quite a while. How many women have gone through this process and how many women have gone through this session and what are the stipulated process for other people to participate?
Okay. As you pronounce that, the Gestational Reproductive Center is a nonprofit center that's a part of the Federation. It is also a National Doula Academy, and doula is a word that just means maternal supporter. So it's almost like a midwife apprentice. And this is training women on how to support women when they're pregnant. This is, just little things from reminding them to eat right, to helping them to deal with the changes in their body and doing the supportive services. Almost like a doula is a nurse and the midwife is the doctor, if you can understand the relevance. So the doula is the nurse to the mother and she's the care and comfort. She is the one that reminds her, okay, let's go out for 30 minutes and let's go for a walk so we can get that exercise in. Don't drink that soda. Why don't you drink some water? Little things that help mommy to remember because she's going through this process maybe for the first time and she really doesn't know. So the doula is there to remind her that there's better ways to do this to stay healthy and stay optimal during your care. So we train those women during that, in that organization. The Gestational Reproductive Resource Alliance Center for Education and Empowerment, also known as GRACE, because that's what it spells. GRACE Doula Academy has been in existence for 11 years now. Wow. And over the 11 years, yes, we have trained well over 250 women. And those women have gone on to, yes, it is impressive. And it's impressive because these are now women out in the community helping maternal care on a personal level. So they are actually having clients. So in other words, Melda, you get pregnant. If I'm your doula, I come and I sign on for the entire time that you're pregnant. So as soon as you find out you're pregnant, you call Dr. Ameena and Dr. Ameena will send the doula out. And the doula will get all your information, where you're going for your care. If you're going with Dr. Ameena, then you just come on into the office. But if you're going to another practitioner or another person that you're doing care with, she'll get all of your information and she'll follow you. She'll remind you of your appointments. She'll remind you, let's go for a walk. She'll remind you, okay, did you eat fruit today? And she'll come into the house and she'll talk to the children. She'll talk to your husband and she'll get everybody on board to help make your pregnancy stress less. Now, during COVID, they were needed all the more because a lot of women were dealing with COVID and the possibility of getting COVID. So the doulas kind of came in and kept the house clean. They were even wiping down counters. I remember one of my doulas telling me I was in there helping her wipe down her stove and her refrigerator just to make sure that we kept the germs down. So they do these things. So they are very handy, very needy, very efficient. And there's no formal training that's needed to be a doula, but there is a training to become a doula. So there are no prerequisites, so anyone can be a doula, any woman. And we want to make sure that they are comfortable in this field of work to be able to better support women that are pregnant.
Yes. Okay, that's very wonderful. I have a very wonderful session with you today, and I want to appreciate you for creating time to do this program. And I want to say to everyone out there, if you want to partake in this, you can send a message to me. I will send the email to you, so you can email Dr. Ameena Ali, or you can also visit the website and get all the necessary information you need there. You can also send her a message through the website.